Hi, good day. This is Dr. Priti Vyas from Sangeeta Hospital, Andheri West. I'm going to talk to you about today a question that there in everybody's mind, but they're so scared to ask. It's about how safe is it to have sex during pregnancy. This is something that a lot of young couples especially come and ask us, because they've been married for a very short time, and they, of course, the hormones are raging and they want to be sexually active during pregnancy, but they're so scared, and then you go and ask Dr. Google, or you go and ask your friends and you don't get the right answers. So I'll tell you how safe or unsafe it is. Let's take it trimester wise. When we talk about the first trimester, a lot of times the doctors tell you not to be sexually active. The only reason for that is that the woman is already feeling a lot of tiredness, nausea, giddiness. She's still settling down, with the hormones of pregnancy. So sometimes the lady is not really up to it. Also, there's always a little bit of fear that what if there is a little extra efforts and there is bleeding during the first trimester, and we don't want that happening because that can land up causing a cause for worry. Second trimester is actually the safest time. That's the time when the pregnancy is safe inside, it is well settled inside, you can exercise, you can travel, you can be sexually active, you can do a lot of things during that time, because that's the time when in fact, there'll be days when a woman would even forget that she's pregnant. The life would be good, her appetite comes back, she starts feeling a little more energetic, and they really start feeling nice about it. So this is the time then, yes, sex is allowed. Only one precaution is try and use a barrier with it, not because she's going to get pregnant again, but only because we don't want any infection out there. What are the positions? Now this is important, okay, especially when we start going towards the end of the second trimester or the beginning of third trimester, where the tummy starts coming, in weight. So that's the time when either it can be the woman on top, or it can be a spooning position where it doesn't have the interference of the tummy and it is also safe. Also, we need to remember that it should try and avoid a very deep penetration, because we don't want the baby or the woman to land up getting hurt inside. Don't want a little inadvertent pressure on the cervix where there's chance of bleeding or anything. The only time when definitely sexual activity should not be done is, of course, if the doctor has said no, if the placenta is low down, which is called as a placenta previa, because any kind of a pressure on it or injury on it can land up causing quite a scary amount of bleeding. If there is any type of abnormal discharge from the vagina, or if there has been some episode of leaking or infection down there, then we obviously have to avoid, because we don't want things to go out of our hand. We don't want the lady to come with preterm labor or with infections. In the last trimester, there were times, when people used to believe, this was more like the old wives' tale, where, oh, you must have sex because in that case the woman would have a normal delivery. This is a complete myth, absolute myth. There's nothing like having sex helps you to get a normal delivery. In fact, in the last trimester, it's quite uncomfortable for the woman. She's not going to be so comfortable having sex, and sometimes it's in fact scary, because we don't want a preterm rupture of membranes, we don't want any infection going there, causing us to have a cause for concern and the baby having any infection there. So in the last trimester, in fact, it's safer not to have sex, especially beyond the 32nd week of pregnancy. So yes, it is safe to have sex in pregnancy, but use a barrier. Make sure that it is the second trimester or early third trimester that a woman is sexually active. And at other times, if she wants to be sexually active, yes, be intimate. Absolutely. It's good to be intimate, but you can also indulge in non-penetrative intercourse. Stay safe, friends. And next time, we are going to talk about what exercise in and how can we exercise in pregnancy and keep ourselves fit. Bye. If you like our video, please subscribe, like and share our videos. And if you want, you can press the bell button. That will help you to get the fresh updates every week.